Hi, my name is Jackie. I'm a student nurse from Cedar Crest College, and this is my presentation on the impact of music with dementia patients in long-term care facilities. So dementia is a clinical syndrome that is both progressive and degenerative and can affect patients' memory, behavior, emotion, and personality. Over 90% of patients with dementia do have behavioral problems such as agitation, aggressiveness, and increased depression. So this can be very distressful to patients and their caregivers, which can be friends, family, us nurses. So that's why it's very critical to develop interventions that's both effective, cost effective, and evidence based to help patients suffering from dementia. There are pharmacological interventions that are used, which can be very dangerous with all these side effects and can decrease patients' quality of life. So my pickle question is, in dementia patients residing in long-term care facilities, how does music therapy compared to pharmacological interventions affect in successfully managing mood behavior in dementia? So I did do a literature search where I used Google Scholar. So the articles I searched for was less than 8 years old, peer reviewed, and were based in the United States. So with Google Scholar, I was able to find 3 articles that really answered my PICO questions. So Cho 2018, their study, they used music therapy, music, medicine listening group, and a controlled TV group as interventions to patients with dementia, and found that with all 3 groups, music was able to improve quality of life and affect with patients suffering from dementia. So it improved patients' mood and behavior. There were some limitations on these studies. They relied entirely on the participants' self-reports, and they had a small sample size. But they did recommend that music therapy senior groups can be an effective non-pharmacological interventions to improve quality of life and effect in persons with dementia. So Quake 2018, or Quake et al. 2018, they also used music listening program to help improve agitation and behavioral symptoms. And as a result, they also found that music interventions positively influence residents' behavior. But they also realized that music may not have the potential to improve the well-being of dementia patients in the long term as they progress through this disease. So there was also limitations to this study as well. There was the possibility of reduced reliability and validity of staff reports, and there was also a small sample size as well. Excuse me, I have a cold. So the recommendation is that practitioners should be educated on how to better understand patients and implement and measure music listening programs to basically potentially improve quality of life to these patients. And last, Ray and Gautel 2018, they also use music therapy to help with these patients suffering from depression. And they found that music therapy can significantly decrease depression symptoms and the well-being of these patients residing in nursing home. So there was limitations to this article as well, with a small sample size, and then they used music and dementia assessment scale, which is still being tested for validity to this date. So recommendations for practice. Diversional activities such as singing and movement should be considered as a non-pharmacological treatment to manage symptoms of dementia. Music therapy and singing can lead to a sense of well-being as indicated in positive self-esteem, a sense of accomplishments, and feeling of belonging. So music therapists, in one of the articles, they believe that 2 weeks of music therapy is necessary to assess the impact of music therapy and to gather information necessary to share with the nurse. Because we as nurses or the nurse aide, we're able to, effectively do these interventions to these patients. Music therapists are encouraged to train professional and family caregivers to utilize active singing to improve quality of care. Patients with dementia can have harmful changes and impairments causing increased agitation and behavior. Improving the behavior and psychological well-being of persons with dementia is an important priority in healthcare professions. Based on the findings of these studies, music therapy is recommended as an effective intervention to improve the quality of life and behavior complications of persons with dementia. So I hope you enjoyed this presentation. Thank you.